I've got 3 minutes to help you with your rotator cuff pain. The rotator cuff is comprised of 4 muscles: the supraspinatus on the top of the shoulder, infraspinatus below the shoulder spine, the teres minor, and the subscapularis. These muscles function to stabilize the shoulder joint, as well as perform functions mainly of external rotation of the shoulder is a unique joint of the human body in that most of its stability comes from muscular and tendinous attachment. There's minimal ligament attachment in the shoulder joint, which allows for people to raise their arms up in multiple directions. This is functional for humans. In my opinion, there are 3 main reasons why people experience rotator cuff related pain that are related to non-acute injuries. One being prolonged immobility. These muscles on the back side of the shoulder are often in a chronic lengthened state from people doing activities such as sitting, typing at work, watching TV, and constantly having an internally rotated and rounded shoulder. Treatment for this prolonged immobility involves opening up the anterior shoulder, including light mobility and stretching exercises to the pec, anterior delt, and maybe even the scalenes or upper trap. The second reason I believe people experience rotator cuff pain is due to poor shoulder mobility. Now, this involves the joint mobility between the humerus and then the 2 shoulder bones, including the scapula and the acromion, but it also involves muscle flexibility. So you have your muscles of the rotator cuff, which have to be able to externally rotate, internally rotate, and stretch. And you have bigger muscles such as the upper trap, the pec, and the deltoid. And these also have to function in harmony with the rotator cuff to provide adequate mobility so you can get good. There are a multitude of options to improve shoulder mobility, including closed chain exercises, open chain exercises, active range of motion or active assistive range of motion. You can also see a therapist or another hands-on professional to help you with some joint mobility. But most importantly, one of the reasons I feel people experience rotator cuff related pain is due to the poor stability and strength that they have of the rotator cuff. There are several exercise options to improve the strength and stability of the rotator cuff. These can be open chain, again, closed chain, or various exercises prescribed by a physical therapist. The important thing is that you're actually stimulating these muscles. You want to make sure that you're providing strong enough stimulus with either resistance, the number of repetitions, or increasing the volume over time so that this shoulder is adequately prepared for daily activity. Thanks for listening to my brief explanation on rotator cuff related pain. I'm a doctor of physical therapy and I do offer one-on-one online training or self-guided programs. You can visit my website, www.rhpmobilehealth.com, for more information.